umurebe wa Ayiho Media nitwakira
ntukwisiye ibintu bitarimo na bimwe umucyanga cyawe ebya masomero tukubitambutse ameso honaho kubori ntukwisiyeho umubwishindi umuntu waburi joshi ntagamba ki umushunga atarize muna zimwe iyo bumbezi umucyanga cyawe abahangu batari bamwe nabo ntukwisiyeho barukushobora okucyanga kitu turi kutambuzibwa etabu nzayituzo nizikura nyingana zigaruka nyuma nabita kabifirwa ntukwisiyeho rere bya maramizo hoho munyana wanje arahanga hari buri kimwe nikibasika eyo bindi no burisa namwe no buzubi nabyo tubukusiyeho kurunje munonga umumenye nitariye mwanemwe iyo tuwebiteho hati oshemererwe munyana wanje likinga o following otweza mani okukora ibintu nkebi no kusiyeho ibintu nyamwingi iyo urukwenda kutayira tukabasa kuba tugambaho nani kugambaho n'abanyarwanda tukuratira namba zose mwezo tukwikiriraho nawo kubora
Ayiho Media ntwasimisa buri kimwe
reka twegitire hamwe tuyombeke twegiteho hati twesimise cyanga cita utakayeba kutukuratira aha mukuretariye mwenemwe a Facebook turiho a WhatsApp turiho a YouTube turiho n'ibindi izo nyingi
the level of facility or what we call sector profile, where we have the DHO's office, we have one health center 4, we have 8 health facilities that are health center 3 level, that is Chamba, Katundu, Katera, Chamba, Karamyoni, Uganda, Chenzas and Dangaro, and then we have Utowa Health Center 2 that is under upgrade to Toto SPA and then Rubirizi Mission. These are our sector. We have the goal and then the objective. One of our goals is good health and well-being of the people through health promotion and disease prevention among all ages. Our objective is to improve the foundation for human capital development through promoting increased access to health services to all categories of people. That's our objective. We want to emphasize on health promotion and disease prevention among the population of Rubirizi. As you all know, that Ministry of Health under Uganda is actually promoting health promotion, disease prevention and control. We all know that non-communicable diseases are taking an increase, and we need to engage people so that they prevent themselves. We also want to engage in community disease prevention and control practices. We also want to adequately respond to any emerging disease outbreaks. So recently we've seen so many outbreaks coming up, and we really want to respond to them. We want to appropriate, manage health, staff entry. Stay has a big number of staff, so we want to manage that entry, stay and exit. Then we want to mount a high caliber of health service delivery, transparency, accountability in service delivery. That is our manpower. As health department, we stand at 32.17%. That means the DHO's office and then the health center tools are still on old structure. So in case they approve a new structure, that means it's lower. It will be lower than 32.17. So we are not doing bad. We are not doing very good under the manpower. About the equipment. That is the equipment we have under DHO's office, where we have vehicles that are functional, there are 2. Then we have 2 motorcycles that are functional, and only 1 is non-functional. At Health Center 4, we only have, and then 2 motorcycles at Rubirizi, and then 2 are non-functional. We have computers that are functional at 9 health facilities, and then we don't have any computer that is non-functional. At Health Center 2, Health Center 3, we don't have any vehicle, but we have motorcycles that are functional 8 and 2 non-functional. Computers we have 10 and 1 is non-functional. On Health Center 2, obviously we don't have any vehicle, but we have motorcycles that are functional. Those are 2 non-functional. There are 5 and non-functional 2 and 1 computer non-functional. In total, we have 3 vehicles for health department that are functional, non-functional 1, and then motorcycle 17. They are all functional, 8 non-functional, 28 computers, and 2 out of 38 are non-functional. These are the equipment we have under health department. We have 3 printers, 1 is non-functional. Health center 4, 2 printers, none is non-functional. At health center 2, we don't have any printers, and health center 2. Development partners have recognized some of the implementing partners we've been working with, HIV and TB. Then under Gavi, it supports us for immunization services. Under local partners, TASO and CORE, it provides support in the fight of HIV, AIDS, and TB. Academic Milestones and Reproductive Health Uganda supports us in family planning services. Mayanja Memorial Health Foundation, it supports us for ICCM that treats children under 5 for malaria, TB, HIV, pneumonia, and diarrhea. Then Uganda Health Activity, it supports us for maternal, child health, and health system strengthening. And then we also have ICHOYA that has been supporting us for community systems fighting malaria, HIV, and TB. Then Barra University of Science and Technology for adolescents and young people health. This is our resource envelope for 2023-2024, 110,835,142 shillings. Then for PhD non-wage, 403 millions. District wage, we have 275 millions. Then development revenues, we have PhD development where we have 1,465 million. And then DDG, now we don't have any resource envelope. The donations, 419,865,000. So the grand total is that. These are achievements that were registered during the financial year 2022-2023. And one of them is the construction of chain link fence at Mubanda Health Center 3, which was completed. I think you well know that Mubanda is well fenced, and I think it's good, we are good to go. Then we also did construction of the general ward at Chamba Health Center 3 in Chamba sub-county that was done on first phase, and then the completed phase is going to come on. Then we also did the construction of a staff house at Chabakara, that is at the completion stage, and also completed upgrade of Chensasa Health Center 3, that is in the picture. We also had an installation of a modern dental equipment at Rubirizi Health Center 4, that is in the picture, and we also did a construction of a patient waiting shed, a renovated mortuary, and a gate at the mortuary of Rubirizi Health Center 2, which was completed. So far, these are achievements that we've done in the first quarter, and we shall see them down, but there is a however part of it. We are saying the software activities the sub-program managed to conduct is support supervision, because we are entitled to do support supervision to all health facilities, then salary payment staff, presumptive vaccination of the frontline staffs against Ebola campaign, then health promotion, disease prevention activities, routine immunization, out and inpatient services, reproductive health services in the entire district. These are the routine activities we usually conduct. During the budget execution, there is lack of accommodation for health workers in most of the health facilities, and I think that is the reason probably some of the health workers come late, probably leave early, because the health facilities cannot be, health workers cannot be accommodated at the health facilities. The sub-program has 2 constituents, but with 1 health sub-district, that is Bunyaruguru, which makes Rugazi overwhelmed. We all know that Rugazi, at its own level, is accommodating so many patients. So we feel if we had another health center for in the Katerera County, probably Rugazi would not be overwhelmed. Most of the health facilities are not fenced, and therefore, obviously, so many things happen around in case staff is not around. The department runs out without an ambulance, which makes referral hard. Obviously, as a department, we need an ambulance to refer patients from either one facility, the lower facility, to Rugazi, or from Rugazi to outside Rubirizi as a district. Then we also have maternity ward at Rugazi that requires renovation or even expansion. These are some of the recommendations. We are saying we need to lobby for funding, construct more staff houses to accommodate staff. We also need to lobby for an upgrade of Rugazi Health Sample to the hospital status. There is also need to lobby for second constituents to have a health sub-district with a health center for. Then we also feel that more funding should be looked to cater for fencing of all health facilities, purchase an ambulance, and then renovate maternity ward at Rubirizi Health Center for. What is our proposed budget for the next financial year 2024-2025? We feel that would be the budget. Then PHC non-wage, the figure is there. Development revenues, PHC under PHC development, and then donation. So the grand total is 5,678 million budget. These are our proposed priorities, but we can adjust accordingly because they are proposed. So one of them, we are saying we want to complete the ward at Chamba Health Center 3 at a cost of 75 million shillings. We also feel we want to construct a VIP line latrine at Kazinga Health Center 4 at 14,263 shillings. We also feel if we could do fencing of Munyonyi, Nangara, and Chabakara, that would be at a cost of 120 million. Then construction of 3 twin staff houses at Munyonyi Health Center 3. And a construction of operating theatre and mortuary at 400 million shillings. Don't ask me about that mortuary thing because we know people are going to die whatsoever. Recurrent activities, we want to carry out monitoring and supervision of rural health facility levels. We also want to train health workers on performance improvement and planning. We also want to conduct public health promotion, disease prevention control, that is sanitation and hygiene activities, supervision of capital projects, establish youth-friendly health services in schools and outside schools, and then conduct nutrition interventions. These are the routine activities we feel we should continuously do so that the people, these are non-funded priorities. Disaster preparedness, preparing emergency supplies for emergencies or epidemics and disease surveillance. As we've said, we've had so many emergency outbreaks. So it is one of the things that we anticipate, but it is non-funded or non-prioritized. Then district ambulance that we feel it would cost 200 million. Dual-purpose vehicle for Rubirizi Health Center 4. Community mobilization, sensitization and sanitation and health promotion and school health, establishing a health center for in Katerina constituency, and then upgrading of Rubirizi Health Center 4 to hospital status that constitute to 60 million. Thank you for listening to me.
Thank you.